Thank you for joining us for another episode of Watson Clinic Health Talk. Watson Clinic's team of physical therapists are specially trained to address a wide array of patients' needs. They can help you regain function following an injury or orthopedic surgical procedure, offer assistance and fast-track care during high school and professional sporting events, provide highly personalized treatments for balance and movement disorders, and much more. The department even offers the invaluable services of a chiropractic medicine and acupuncture specialist. Here to discuss all of this and more is licensed physical therapist, board-certified orthopedic clinical specialist, and Watson Clinic Physical Therapy Service Line Coordinator, Jack Ryals. Watson Clinic patients can receive physical therapy care from 3 convenient locations: Watson Clinic Highlands at 2300 East County Road 540A in South Lakeland, the Watson Clinic Center for Specialized Rehabilitation right down the street at 2190 East County Road 540A, and the Watson Clinic Center for Rehabilitative Medicine at 1430 Lakeland Hills Boulevard near the main clinic. Appointments are available through physician referral. Call 863-680-7700 or visit watsonclinic.com/physical therapy to learn more. Thank you so much for being here, Jack. I appreciate it.
Thanks for having me, Jamie.
Let's talk about physical therapy. What exactly does a physical therapist do?
That's complicated. So we have a number of different angles. We essentially are the leaders of helping someone get from where they're at to where they want to be. It's kind of a mix between healthcare and performance. So we don't treat the diagnosis. We treat the patient. It's common for me to get a question such as, hey, I got low back pain, what can you do for me? And that's really short-sighted. When I meet someone like yourself and you come to me with your ailment, I got to sit down and read you also, because there's a number of different ways to get people better. Some misinterpretations would be that, hey, there's just going to be some exercise I give you. You're going to go home and you're going to do them. You're going to get better. And there's a different side of that spectrum where I'm going to do all the work for you and you're going to get better. There's somewhere in between that where I've got to read you and decide, how am I going to get this guy from where he's at to where he'd like to be? And it's a mixture of the diagnosis, and it's a mixture of the art of medicine to say, how do I get this person from point A to point C? And the B could be a number of different things. Mm-hmm. So I got to size up your lifestyle. I got to try to read you for where's your buy-in going to be. Some of my favorite ones are post-operative patients. You know, I had a guy yesterday that's just profusely sweating just looking at me. Because he's coming off a tough rotator cuff repair and he's uncomfortable. He's heard horror stories of physical therapy, and I'm reading him. You know, I know what I got to do for the day, but I'm thinking, what's this guy going to look like 3 months from now? And so I gotta start prepping him today for what I want him to look like 3 months from now. And so it's an interesting profession for sure.
So you mentioned rotator cuff repair. So obviously, injury or wear and tear post-operative. What are some other conditions that might elicit the need for a physical therapist?
Yeah, that's a great question. I mean, we see any patient from a few months old to 100 years old. I have a pediatric specialist that works with us, and then we have geriatric specialists that work with us. And then everything in between. We have athletic trainers. As you know, we have a chiropractor. Our scope is from birth to death, really. Okay.
It's essentially you're experiencing discomfort and perhaps a lack of mobility, and how do we restore that for you?
100%.
Yeah. So your conversations with the patient where you get to know them and their needs and what scares them about the process or what have you, how much conversation goes into the following up with the specialist who referred them?
We establish a plan of care. So patient X comes to see me from Dr. Y, and after I complete the evaluation, that is sent to them for a cosign.
Right.
And so the summary of that visit is within the Epic system. And then if it's an outside referral, we fax that to the provider that sent them.
Yeah, the patient portal and the electronic medical records that follow a patient everywhere they go in the clinic, that really is invaluable.
Oh, yeah.
Yeah, absolutely. So one concern people have about physical therapy is often, is this going to hurt?
Sure. Yeah, and that's part of that first initial evaluation moment is I've got to read you for what makes you tick. I mean, essentially, people come to see us when they're at a low moment.
Yeah.
Very few people are coming off of a high experience and saying, "Hey, I'm looking for a physical therapist. Something's gone wrong." So in the psychosomatic nature of what we do, I've got to figure out where you're at and then where you want to be. And it's not always where you used to be. Sometimes it's above that. So you may have been struggling with something for 1, 2, 5, 10 years. And it's not that you're trying to get back to the way you were. You might want to get back to where this doesn't happen again.
Yeah.
Right? So that some of our choices, habitually or otherwise, land us in a spot. And then in that spot, you're seeking help.
Yeah.
And so that's why I said, I really try to get my colleagues to get off of the medical diagnoses and then try to summarize, hey, what direction are we heading?
Let me talk to you about the various groups of people that you treat, starting with athletes, either professional or weekend warriors or school-aged athletes. Tell me about that dynamic.
Yeah, I mean, I was fortunate to get some early training in college. I worked for the University of Florida football team, and one of our first ACL reconstruction / rehab was a running back for the team. His name's Fred Taylor. And his picture's up on our wall in one of our offices, and I was carrying him off the field. The reason I quote that for the people that I see is he's number 17 in the all-time rushing in the NFL.
Oh, wow.
He's now retired. But I say that because when anyone is hurt, it's very possible that they end up being a higher performer than they were prior to their injury. It's well shown, well, not well shown, but it's well accepted that you take a elite athlete that maybe never did intensive unilateral sports performance, and then they tear an anterior cruciate ligament. That's repaired by a surgeon. And now because we're going to rehab for 9 months doing unilateral human performance, that sometimes the outcome is superior to the pre-injury status.
Interesting. And rehabilitation, the amount of time it takes someone to recover, that differs patient by patient and condition by condition, I would imagine.
Yes. Condition by condition for sure. Patient by patient, there are some general guidelines that are pretty accepted for things like ACL repair, Achilles repair, rotator cuff repair. There's certain things you can't beat Mother Nature per se.
Yeah.
But yeah, people recover in different
But
ways,
generally,
for sure.
I would think that it helps the more physically fit you are, the easier it is to kind of get back on it.
Yeah, I think that's fair, but it's certainly not consistent.
Okay.
Some of the biggest, some of the softest patients I've ever had have been elite athletes, and some of the kick butt patients I've had are grannies. You'd be surprised. I mean, we get some elderly patients coming off of joint replacements or rotator cuff repairs, and they just do amazing.
Yeah, they just get on with it. Yeah. High school football, high school sports teams, we're out there in the community as a department, and Watson Clinic in general, our orthopedic surgeons, everyone involved in this realm of healthcare. We're out there attending games, standing at the sidelines. What exactly is our role at those venues?
So our push that started, 12 months ago was that we wanted to start being more present, almost like a giving back type of situation. So it's not so much that maybe on the sidelines I'm going to go fix anybody. We're there as a presence, somewhat even just a calming factor of someone's here to help lead what goes wrong. if something goes wrong terribly on the sidelines of a sporting event, it's not necessarily the need of the individual to quickly administer CPR or to quickly stabilize a fracture. It's just someone with experience and someone with the overall leadership skills to say, okay, this is a 911 call, or hey, this is nothing. This is okay.
Okay.
And the Polk County area is one of the few counties that's underserviced in this area. There's many other counties in the state that provide athletic training services per school, and that's just not present in Polk County. And so some of our competitors included have realized that that's just a need in the area.
Okay.
So we're actually just trying to meet a need.
So tell me some of the schools that we work with.
We've done all the sports at Polk State. We've worked with Fort Meade, Victory Christian Academy, Auburndale High School. Those are some of our current ones.
And do we handle the Tigers as well?
We do, the Detroit Tigers, yeah.
Right. Well, that's impressive. So give me an example, because in the past, you've communicated with us about, look how coordinated we are between physical therapy, orthopedic surgery, radiology. Look how this person's care has been fast-tracked. Could you give me an example of how that works?
Yeah, I mean, we've identified that access is a desirable thing for any of us, right? So your car breaks down, you're wanting access to a mechanic. Mm-hmm. And when there's a healthcare shortage or there's processes to be done for the patient to be seen, that can sometimes be interpreted as lack of access. And so what we've done this past 12 months with that kind of access is, if someone like myself can get a hold of someone like Dr. Gruhanek,
orthopedic surgeon, right.
Who says, you know what, I can fit him in tomorrow. And then because he can fit him in tomorrow, we get the imaging tomorrow or same day. And then as that's expedited, one, the care for the individual that's hurt is top notch. Mm-hmm. But then secondly, this feeling of accessibility is very comforting to someone that's in need.
Right.
Right. You don't call for anybody until you have a need. And then if no one picks up the phone, that's a problem, right? You get arrested tonight and you call and no one picks up.
It's likely to happen. Yeah.
So in those moments, what we're starting to realize is this is not just healthcare. This is somebody in need.
Yeah.
And they want to pick up the phone, or they just want to know that there's somebody that's advocating for them that would expedite the need being met.
That's so true. I mean, like you said, not only the convenience, but the feeling that, okay, they got it taken care of. Like I don't have to follow up a million times myself. They got me on the fast track here, and they're concerned about it. Is there a case when a patient suffers from an imbalance disorder? Is there something that physical therapy can do to help in that regard?
Big time. We have several, not myself included, we have several specialists that specialize in the vestibular system.
Okay.
So there's 3 bones in your inner ear, and there's some canals, and there are crystals. And so essentially, you can be off balance because you've got a problem between your ears. But there are some maneuvers. There's one that's called the Epley. But there's different ways that the vestibular specialist can manipulate your head, body, neck in ways in which they reposition these crystals. And I've had people get better instantaneously from some of the people that work with me.
Oh, that's amazing.
And then if it's not that, we live in a body that's use it or lose it. So this ability to stand on one leg seems simple, but if you can't stand on one leg, you really can't take a safe step forward. Because the definition of walking versus shuffling is that there's a period of time where you're on just one foot. Mm-hmm. So I ask patients, hey, can you stand on one leg? And they're like, why do I want to do that? I'm not a clown. Well, you can't safely take a step forward if you can't stand on one leg.
And neuromuscular, anything like Parkinson's or any conditions like that?
Yeah, all those things are in our scope of practice.
Okay. Mm-hmm. And just a couple of years ago, we introduced the specialty of chiropractic medicine.
We did.
And I know that Dr. Banks, he's been a previous guest on the podcast, and he's also taken up acupuncture as well for patients. And both of these have proven enormously helpful to patients, but also enormously popular.
Yeah, and that kind of goes back to what I said before. When I meet a patient, I got to size them up. I mean, it might be that they're just not buying what I'm selling, and part of that is sizing them up. Are they going to be more appropriate for alternative medicine? So I don't know what the stats Jalen gave you, but it'd be something like 20% of the population kind of falls into the belief system of chiropractic medicine, something like that. But if that group has that mindset of I'm out of place, something needs to be put back, and they're not buying into me, those are the situations where it's appropriate for me to punt to Dr. Banks. Mm-hmm. And then conversely, when he identifies someone that's more appropriate for me to work on their performance, their movement, he'll punt those to me.
Okay.
Or to us.
And how long have you been doing this?
27 years.
This field has probably evolved greatly since you first started, just in terms of technologies alone. And we have some pretty impressive technologies in our department, don't we?
Yeah, and I would say the technology really is the human mind and the performance of the therapist. When I finished in the mid to late 90s, and I joined the Watson Clinic, we did do a lot more passive things. And so it used to be that, there was a machine that plugged in and it produced this. It gave me some warmth, it gave me some electricity, it gave me some sort of something. And back in those days, there was some buy-in that this passive modality was going to produce pain relief, right? We've moved way past that when we go into evidence-based practice. And so where I would say the technology, I probably wouldn't use that word, is more of we've kind of upped our game with what the expectation is of the therapist. It went from a bachelor's degree to a master's degree, and now it's a doctorate. So you can't have a license as a physical therapist without a doctorate.
Wow. Okay.
So there's some downsides to that financially, of course, because you're stuck in school a lot longer. But the expectation is that, hey, this is going to be the leader of, taking you from point A to point C, and we got to figure out what route we're going to take to get there.
I know that people don't contact you until they have a need, but you have to have some insight on injury prevention. And I'm wondering what practical advice you can offer just anyone out there taking care of yourself physically and preventing the risk of injury.
I would say for the general audience, we are in a use it or lose it type of situation with our bodies. We're naturally, just like a car, you're going to have wear and tear. And if there's not some sort of maintenance to the car, there's going to be earlier breakdowns. Mm-hmm. I think we've gotten significantly more sedentary as a society.
Yeah.
There's just a lot of sitting. And we're not really meant to be sitting for too long as far as our overall morphology. So a lot of those things that we end up treating is not necessarily been from injury per se, has been more like attritional breakdown. So you sit for 8 or 10 hours and then you come to me for back pain. That interview is really important because I really have to figure out how I'm going to get you from where you're at to where you want to be. And it might be that you do some of these podcasts standing.
Oh, is that what you're suggesting?
Just came to me.
It's probably not a bad idea. Occupational therapy, before I let you go, what is that? How is that different from physical therapy?
Sometimes it's not. Other times it very much is. Occupational therapy specifically specializes from the shoulder tip to the fingertip. But specifically, our department specializes in hands.
Okay.
And there's a subspecialty within our field that's called a CHT. And it's a highly respected board certification, certified hand therapist. But the guy we have here that we have loved having is Robert Johnson, goes by Dean. And he works closely with our hand surgeons to specifically work at the very small level of splinting and the fine motor movements of the fingers and the hand. It's a very intricate specialty that we're lucky to have them.
Thank you so much for coming in. I really enjoyed this conversation.
Yeah, thanks for having me.
That's it for this episode of Watson Clinic Health Talk. Find out more about our physical therapy department by calling 863-680-7700 or visit watsonclinic.com/physical therapy.